Hi, in this video I'm back to talk a little bit about diastasis recti. So in the last video I mentioned that I used the 90-90 technique in order to also treat diastasis recti, and I had some questions about how I do that and what my process is. So I thought I'd just take the time to go over that with you guys. So as you might know, diastasis recti is the separation of the rectus abdominis with the lengthening or the loss of tension and thickness of the linea alba. This happens a lot in pregnancy. As the abdomen gets bigger, it tends to separate that linea alba, and the abs start not being able to contract well because of the length of that muscle. So with pregnancy, you get a separation of the abdominals with the linea alba it loses its tension. And so what happens is, with the loss of that tension, what happens is the abdomen stops being able to manage the pressure inside the system, as well as a lot of times the abdominal muscles themselves lose their ability to contract well. There's a lot we can learn about that separately, but I want today's focus to really be about how I address those things. So because when we lack strength, what we tend to do is find a way in order to get things done. I mean, especially when you think about the life of a mom, you don't just get especially these days, you don't just get to lie around and rest. Even though that might be a good idea, it's just not what our society allows. So what you have is, after moms have babies, they have this weakness in their abdominal cavity because of the lack of the ligament support, as well as a lot of times the musculature around it isn't firing well. And so, you're still carrying car seats. You probably have another kid that you're trying to carry that other kid, and one of those horrible car seats that we all have schlepped around. So what we tend to do is use a different technique in order to support our system. We still have to do what we're going to do. It's how we do it. So what happens is people try to use a Valsalva technique for stability in their system. And so what we'll tend to do is try to force air out against a closed glottis. So that stiffens our middle to allow us to do the things that we're going to do. The problem is when you have that lack of ligament support in your abdomen, there's actually nothing to push against from the pressure. So what you'll tend to see is actually a tenting of the abdominal cavity of the abdomen, and so it'll peak like this because it's no longer able to resist pressure. Well, what that does, of course, is then the muscles of the abdomen, the ones that should actually be working, are actually coming further out and preventing their use even more. So when treating diastasis, we have to go back to stage one, to step one, and really help these people find the position where they can actually use their abs again. And so we need to take all the pressure out of the system and allow the rib cage and the pelvis to be as close as possible to give those people as much opportunity to find a true abdominal contraction again. The best way to do that is to decrease the abdominal pressure as much as possible by giving an exhale, which will pull the belly in, bring the rib cage down close to the pelvis. When you have that position, the abdominal muscles have the most opportunity to work together. So the way I do this is have people practice exhaling as much as possible without pushing out. A lot of people will, towards the end of an exhale, they'll use a compensatory strategy to get the rest of the air out, and that would push the belly out. So we don't want to go there, but we want enough of an exhale for them to to feel their abdominal muscles contract as they're pulling in. So that means they're able to contract their abs, and we have the least amount of pressure in the system. So it's important to start at the level that the person can manage the best. I see a lot of people, have the idea that, well, you can't crunch, but, everything else is fair game. Well, if the person is trying to use a Valsalva technique to stiffen their system and still tenting, then that activity, I don't care what it is not going to work. And if they're not getting a sense of abdominal contraction, it's not going to work. So I'm always going to start the patient out in a position where they are able to exhale properly. The belly goes in, the rib cage comes down, and start to sense the idea of the abdominals contracting. So if they can't do this on their back, everyone's different, so you really have to play around with this. I might start them on hands and knees if I feel like that's something that they can control. And I'm always there. So any position that they are not familiar with, I have my hands, or I have them just tuck their shirt up a little bit so I can see their belly. Now, remember that women postpartum may be really uncomfortable with their bodies because they've made a big change. So this would be appropriate more in a private room, and to always ask them if that's okay. But so if they're on hands and knees, I'll have them do the exhale and see if I see their abdominals pulling in and that rib cage just gently dropping down. I don't cue them to drop their rib cage down. I have them do it with the breath, and that's really important. So if hands and knees isn't good, side lying might be the position for them. So we really can take it down to the least stressful position to help them feel their abdominal muscles as they're doing a gentle exhale, a full but gentle exhale. Remember, we don't want any Valsalvas. So if they start out doing any kind of pushing with closed epiglottis, you got to shut it down, or at least try to cue them out of it, and then go to something simpler. So then what I do is I start working up from whatever their base level is, their foundational level is, we start working up. So we go from let's just say we take it to they're in side lying at first, and that's where they can feel their abdominal muscles. So then from side lying, I might go to a 90-90 position, or a quadruped hands and knees position, and then I slowly work them up from there to doing different exercises in those positions to make sure that they can manage their producing force in their limbs without using a Valsalva maneuver, because remember, it doesn't work. It's really causing more harm. And then we work up, we do things in those positions. Then from there we would go to like a half kneeling position, again trying to manage those positions. And it's really important. I had mentioned to someone, and they really wanted clarification on this, that it's important that we don't stop too early. So if you've ever gotten out of bed quickly in the morning, especially with kids, a lot of my examples are with kids because those are the people I treat. But, if a kid is vomiting, or just even a baby crying, you have to get out of bed quickly. And so a lot of people come straight up because that's what they're used to. What they're doing, if they don't have those abs, is they create that Valsalva technique and they're coming up. Remember, that's making things worse. Even though it might give them a little bit of stability at the moment, over time it's just making things worse. So we have to teach women how to curl up. It's not okay to stop before we hit that point. And so instead of telling them, oh, just don't do that, that's not fair. If they're willing to work on it, we need to give them an opportunity to really get the function of their abs back, where they can exhale. They don't need the pressure to stiffen their system to come up. We need to teach them how to do that muscularly again. And so I'll start working on very low level crunches because they already know the technique of the exhaling, grabbing those those abdominal muscles in order to move their body. So we have to teach them how to do that in a curl up motion. motion or a whatever you want to call it, a crunch, a sit up, at some point they have to be able to do that functional ability properly. Otherwise, you're going to see, otherwise they're going to keep using that technique and potentially continue dealing with the diastasis recti. At that point, then they're going to potentially go to surgery or something like that, where maybe they would not have even needed to do that. Now, working with women and men, anyone working with new parents is it's a lot of give and take and really reading where that person is. So there are people that have wanted to work on it, but they're so stressed and so tired, and they come back and they're like, I didn't get my exercises done. And that's when you don't have to say, hey, you need to do these exercises. You need to make this a commitment. It's just time to ask them to say, you know what, we can address this another time. Let me just show you some techniques to not make it worse. That's like where we, show them how to roll over in bed instead of pushing up, and to do that as often as possible, and give them some simple techniques, and then readdress later on. So that's a little bit about how I treat diastasis recti. Feel free to send any questions or comments or opinions. Thanks for listening.